Our next speaker is Paul Lee from the Southern Polytechnic College of Engineering Technology, the Department of Electrical Engineering. And his talk will be on shedding light on the brain of pediatric sickle cell disease.
When was your last time to have severe headache and dizziness? Maybe during the COVID-19. Let's take a couple of seconds to think about that moment. Very uncomfortable, painful, you couldn't do anything. Now, how do you feel if that pain is very frequent? Now imagine that frequent pains happens to children under the age of 5. My final request, imagine those children live in an area where all the healthcare resources, infrastructure is underdeveloped. Today, I'm sharing the story about children with sickle cell disease in sub-Saharan Africa. This New York Times headline reveals the heartbreaking reality. This one family lost 3 daughters. In this region, tragically, half of these children do not live past age 5. My talk today is about providing solutions to stop part of this disease, tragedies. Worldwide, 300,000 babies are born with the sickle cell disease. And then 75% of them live in sub-Saharan Africa. And in this region, actually lack of access to the adequate health care and then screening for these children. Actually, sickle cell disease is prevail in the area. The sickle disease is originated in the area where malaria is widespread. Having one copy of the sickle gene actually helped the protection against malaria, but having both genes have a big health problems. Actually, sickle cell disease changes the red blood cell and rigid and sickle shape, and then harder and stickier. It's hard to flow smoothly throughout the vessels and inducing lower oxygen delivery to each organ, so causing the widespread of the symptoms. And from infant, sickle patients suffer from repeated episodes of stabbing pain in oxygen-starved tissues. Actually, the symptom depends on where the blood vessels are blocked. And it can affect the multiple organs, spleen, vision, or hurt lung. And one of the devastating outcomes is the brain disease. The risk of stroke for these sickle children is actually 300 times higher than the general population. Can you believe that? So managing the screening of this risk is critical for improving their quality of life. And in high-income countries, this advanced neuroimaging modality like a PET and MRI are used to identify the abnormality in the brain. But as you can see, it's huge, prohibitively expensive. Like it requires anesthesia sometimes. So making this technique not suitable for low-resource setting use. And the current standard of care is the stroke screening in pediatric sickle cell disease is a transcranial ultrasound. It measures the high blood flow velocity. That's the indicator of the high risk of the stroke as a way to compensate for low oxygen level. So once high blood flow is identified, they need transfusion therapy. But still, the transcranial Doppler is very expensive, and they require the skilled personnel. So the only 8% of the sickle children in sub-Saharan Africa can access the screening protocol. So to address this unmet medical technical needs, we want to propose to develop the light-based sensor. What is a light-based sensor? You already have one. So Apple Watch, do you notice that? Apple Watch emitting the green light to measure your heart rate? So it's based on the technology named the photofluorescence. Anyone try to say it? Photofluorescence. So actually, light is a fascinating tool probing biological tissue. While it propagates inside the tissue, it can collect the information about the movement of the red blood cell and also the oxygen binding status. By analyzing detected light, we can quantify brain blood flow and the oxygen level, which are biomarkers for brain health. Actually, using specialized light called the near-infrared light, it can actually penetrate skulls to reaching the brain tissue, and then we can, this unique capability allow us to to measure cerebral hemodynamics without any invasive procedure. So during my postdoc training, working with the clinicians at Children's Healthcare of Atlanta, I applied the optical techniques to measure the sickle children's elevated blood flow and their reduced oxygen level, which is indicate for high risk of stroke. So this pilot study on nearly 50 patients demonstrate the technical feasibility of portable novel system. Since I joined KSU 2021, my lab is really dedicated to the developing low-cost, affordable, and novel light-based sensor, wearable sensor, to stroke risk screening in pediatric sickle cell disease in low resource setting. So actually, not only about the technology, we formed the multidisciplinary teams, including the expert in the global health and mobile health, even documentary filmmaker. So this multidisciplinary approach is really crucial for addressing this type of medical, technical, social challenges to implementing this technology globally. So our team is planning on the pilot study on Uganda. Actually, Uganda is one of the African countries that significantly affected by sickle cell disease. Actually, I'm visiting the Uganda 3 weeks later. I got all the vaccination, so I'm so excited. So our team established a strong partnership with the local clinician in the largest sickle clinic center in National Mulago Hospital in Kampala. So we're gonna run some the pilot prototype testing in real world setting and to refine our usability. Not only do that, we're doing some work on the parent engagement, education, local capacity buildings. Okay, ultimately our goal is to protect lives and provide hope. Who wants to hold their hands? So all together, we can bring the innovative solution to the children with the sickle cell disease in sub-Saharan Africa. And then your support can help us to make these screening tools more accessible, and then we can improve countless lives. Thank you.